Right, tonight we're going to talk about a little bit about dementia, but I do want to give the caveat that this could be a college course. So I'm just going to kind of skim the information here. How many of you have had some experience dealing with a loved one or someone you know that has dementia? So most people in the room have had some experience. So feel free to jump in and talk about your experience. Again, I'm just trying to give you today a general overview.
Margaret, when do you know that you're with someone that has dementia?
You know what? Let me get through the first, that we're going to talk about that first. So it's coming up. Okay, all right. So in our country right now, there's over 7 million people with Alzheimer's disease. It is the most common form of dementia. And what I'm going to help do tonight is just going to give you, again, a broad overview, but also talk about how we can walk alongside someone with dementia. So as Stephen ministers, we'll probably be dealing more with the loved one or the caregiver, maybe than we will with actually the person with dementia. But either way, it's walking that journey with them, and it fits very well with dealing with people with dementia. So, what is dementia? And it's a loss of mental function in 2 or more areas, such as language, memory, visual, and spatial abilities of judgment that are severe enough to interfere with daily life. And that's a really important point because all of us have memory loss. I mean, and as we get older, we have more memory loss. So it's normal to forget where you put your keys. Or it's normal to forget that you left something out of the refrigerator. All those kinds of things are very normal. When it gets to be not as normal is when things start to interfere with your daily life. So examples. You may go to the doctor on a Monday, and on Tuesday you go back to the doctor for the same thing, and you didn't remember that you had been there on Monday. Or you get up in the morning and you know that you like coffee, but you can't put together the steps that it takes to get the coffee out of the refrigerator or wherever you keep it, grind the coffee, put it into the cup. You can't put together those steps. So that's the difference really between dementia and just forgetfulness and some kind of loss of memory. And of course, there's lots of things that can cause us to be more forgetful, like what? What do you find in your own life that causes you to be more forgetful?
Stress.
Absolutely. So I find that if I'm working and things are going on at home, I can't remember anything. And that is very, very normal. Did you say sleep? Fatigue, yes. Fatigue, if you haven't been sleeping well or not getting enough sleep, those are all normal things that would be in a normal range that would increase your forgetfulness. Dementia is a progressive illness. So what happens in Alzheimer's is that it will start in one part of the brain and then it can kind of progress around other parts of the brain. The part of the brain where typically with Alzheimer's it affects less, I think it's the left side or the right side, but it's the one that affects songs, music, rhymes. So you'll find that people that are fairly progressed in Alzheimer's can often sing songs. They can finish nursery rhymes. If you start a nursery rhyme, they can finish it. They can swear like that because that's the same part of the brain. So, people with dementia and Alzheimer's sometimes will come out with this string of expletives, and it's because that part of their brain has not been. Yeah, now you know. Right. We don't have the answers for why people have dementia, and it does not necessarily run in families. So just because, in my case, my mom has Alzheimer's doesn't necessarily mean that I will get Alzheimer's. What does tend to run in families is early onset Alzheimer's. So if you get Alzheimer's by the age of 60 or before, that is the type of Alzheimer's that does tend to run in families. At end of life for people who have Alzheimer's in particular and dementias is that the brain is so deteriorated that it starts to shut down the use of organs. So, it's just not sending the signals. Swallowing is a very typical thing. And so people, because they aspirate, they're not swallowing properly, can sometimes get pneumonia and that kind of thing. So typically at end of life, we won't put feeding tubes into people or anything like that because it's just the body can't handle it, and it's not an easy thing for the patient. They're learning a lot about how to prevent Alzheimer's. I mean, the number one factor that will increase your chance of getting Alzheimer's is, does anybody know? Age. Just age. The older you get, the greater chances you're going to get some kind of dementia. But they're finding a lot of things, lifestyle factors can help, like controlling diabetes, controlling blood pressure, all the things that you hear about, diet, exercise. Those are all things that also can help push back the onset of any kinds of dementia. So I'm at the umbrella. So what is dementia? Dementia is the broad term that's used for different types of diseases. So Alzheimer's being the number one form of dementia, but there's other ones. There's Lewy body disease. Those people keep verbal skills, but they have these huge mood swings. Vascular dementia is caused by stroke and other cardiovascular diseases. Probably one of the more difficult ones for people who care for people with dementia that live in like nursing homes and that kind of thing is a frontal temporal lobe. And that's really does hit you right in your temporal lobe. It tends to come on with people who are younger, and it's people that have just very difficult behaviors combative, very, very combative, very impulse driven, very difficult to deal with those kinds. It's probably angry outbursts, they'll be screaming and shouting. And so what the saying that they use around dementia or Alzheimer's is if you've met one person with Alzheimer's disease, you've met one person with Alzheimer's disease, because it starts in different parts of the brain. The pattern is not the same. So you can't assume that just because you know someone who's had the disease, that the next person you meet with the disease is going to be the same type of illness. Can be totally different, same disease. At the Alzheimer's Association website, they've got great information on their website, but you can, we took my mom in when we first started suspecting something was going on to once in Arizona, and then when we got her back here to get a cognitive test. They ask a lot of questions. Of course, you can never confirm until after death when they do an autopsy, but they have enough in the way of testing that they can pretty well tell you if you have Alzheimer's or not, and they can stage it. So there's stages 1 through 7. 7 would be, you're bedbound. You can't put more than a few words together. The words that you are putting together make no sense. So they may talk, but you just have no idea what the sentences are not making sense. So they have a pretty good idea, or they can tell you. On the next page at the top, on page 2 at the top, why is relating to someone with dementia different than relating to anyone else? So people with dementia experience short-term memory loss. And this can be really frustrating for people who are caring for them, because what happens is you may repeat the same thing a zillion times because they don't remember that they just told you something. And also, they may not remember what they had for breakfast, but they can tell you exactly what happened 20 years ago. So sometimes it can be a little confusing when you're first dealing with this, because you're thinking, well, why can't you remember what just happened? But you can remember what happened 20 years ago. And it's that part of your brain that connects into short-term into long-term memory. Those wirings are one of the first things to kind of get eaten away, and so people honestly don't know what just happened. An example with my mom that happens all the time is she won't remember, even if she had, like, she'll look down at her clothes and say, did I put this on? Like, she'll have no recollection of, putting something on, or if she took her medications or any of that. So the other thing that happens is that it progresses. So you have to figure out, one of the things is, where are they in time? So are they 10 years ago? Are they 20 years ago? Are they 50 years ago? Where are they? Because it will continue, the disease, as it progresses, it will continue to push back into time. So the important thing to remember is not to argue or correct. So what we try and do is find happy times that they can tell you about. So finding those happy stories in their life is something where they're feeling confident in telling you that story and they feel good about it. So you may hear the same story a million times, but they may be getting very excited and happy about it every time they tell you, and that has to be okay. You just have to go with it. So the thing that's going to be difficult when you're dealing with family members who are dealing with someone with these dementias is their loved one may say, you never visit me. How come you never visit me? Well, they may have just been there like yesterday or today. And that they're lost in those days and weeks. So you always are going to kind of have to redirect them into stories that you can have fun with and kind of go along with. As the disease progresses, it's harder and harder for them to live alone. They may be doing things like leaving a pan on the stove, or you just can't have that confidence that they will be safe. So putting those safeguards in place to help them live wherever they are for as long as possible, or where they want to be, is really an important support that you can give to them. If you have questions along the way or want to add anything, just jump in. Okay. So let's talk a little bit about what a person with dementia is experiencing. So they're experiencing a lot of loss. They typically know that they aren't remembering things and things aren't the same. They do. They know it's, and they sometimes, some people with dementia also get depressed because they're that kind of person that they know that they're losing it and they just can't have the control that they once had. They know that they can sense that people are frustrated or impatient with them. So they look for facial cues. They may look at your expression or your body language, or are you impatient? And that can be negative for them. So part of the challenge is to figure out what they're feeling and validate it. So, for example, this middle slide where it says anger, you'll often hear people who are at the point where they're in residential facilities for Alzheimer's, they'll be very anxious because it'll be the end of the day and they know that their kids are waiting for them to be picked them up from school, and they're like upset, like, I got to get to the bus stop. My kids are getting off the bus. I have to get, I need to get there right now. I need to get there. And so, it doesn't help to say, your kids are 60 years old now. They're not getting off any bus. But you can say things like, someone else is picking up your kids today. Tell me about your kids, and try and kind of go with the flow. Again, going back to the body language and all that, but to try and remain in a calm state yourself and be joyous. And again, I think just going with the flow is very, very helpful. So that person may feel lost, confused, anxious, vulnerable, helpless, frustrated, angry. And then common behaviors, agitation, aggression, some wandering, activity disturbances, depression or apathy, withdrawal from the situation, and crying. There is a term that's used in the Alzheimer's area called sundowning, and they find that people with Alzheimer's often can get agitated around the 5 to 7 o'clock time for whatever reason. It just tends to be sometimes in the later stages a more difficult time for them. So the thing to remember is that they're not laying awake at night trying to figure out how they can drive you crazy. It's not their goal. That their behavior problems are caused by damage to the brain and are not something the person can control or prevent. I happen to have a family member who will literally sit my mom down. I think I've told you all this before because this drives me crazy. And give her a talking to because you're just not doing what you should be doing. And I'm thinking to myself, it just makes my blood boil. You really have to walk with them where they are. And this is the true, I think, test of being able to do that. So joining the journey, best way to interact with someone with dementia. My mom, this is another funny thing. She'll look out, last week or week before, she looked out and she goes, oh, this is going to be a beautiful spring. Now, you want to go, it's January, Mom, it's not spring. But I find that if I go with it, yeah, I love spring. I love when the flowers start popping up. And, if you just don't fight it and go with it, it works out much better. So the person with dementia is living at some point in time in his or her past. They can't be brought back to the present by prompts. Remember this, remember that, remember this. They don't remember that, so it's easier just to kind of try and be with them. But when we join their journey, we enter their world and comfort them by helping them express their feelings. And doing that reflective feeling. We'll talk about that a little bit more on the next page. So I'm on page 4 at the top. So how can we help them to express their feelings? So you have to remember that the emotion they're feeling right now is very real for them. So that woman or man who needs to get to the bus stop because their kids are getting off the bus and they're not there, that is a true emotion for them. So to downgrade it or say, oh, you're not feeling that is not true. They are feeling that. So to validate that and acknowledge it is the quickest way to make it go away. Because you're not going to argue with them. You're not going to, you're not going to reason it out of them, and you're not going to be able to argue with them about it. Or to say, you seem sad today, or sometimes you don't need to talk. Sometimes, as we all know, you just being present is what's most comforting for them. And then that just being positive and reassuring. The number one thing I think to help dealing with somebody with dementia is to manage your own emotions. And I've learned this just from dealing with my family, is that my mom doesn't change much from day to day. What changes is me. And when I have days when I'm busy or if I'm stressed and I'm with her, I really have to take a moment and calm myself down and get into the flow, because she and I we have tons of fun together. I mean, I'm definitely on the same level she is, but I have to get into that flow. I can't go in with my normal, got to get this done and this done and this done and this done. I have to, it's all about me and changing my way of interacting. It's not going to be about her. And my body language and tone of voice, I think, are critical. I can see my mom freeze up when she's with the family member who's judgmental, and she gets worse. I can just see it. So you really have to watch your tone of voice and I think your body language. They often use relaxation techniques with people with dementia, especially towards the end. They have what they call namaste units in many of the facilities now. So even just helping them to breathe in and out, just to take a moment and breathe in. If you feel that somebody's getting agitated, sometimes that can really help. A gentle hand massage using a lotion. They use this technique, grab my hand. So I can just kind of go like this with you. And I'm just kind of pumping her hand very gently, but it can kind of get somebody into a, calm rhythm. Figure out if there's just too much stimulation. The music often helps. I have a couple of CDs of songs from the 40s, and my mom knows the words to all those, and we sing them in the car, and we turn on that Sirius station. So that's a lot of fun. So moving to kind of looking at this from the caregiver's point of view, emphasize doing a task rather than the completion of a task. So it's easier to say, let's get your shirt off rather than we're going to take a shower, because there's a million steps in between taking your shirt off and taking a shower. So if you take it a step at a time, that seems to help. Accept the person's feelings. Again, trying to express what maybe they can't express through their body language. Use phrases such as, we can get through this together, or I enjoyed this time with you, or sing, or have the music on, something like that. So at the end, they won't be able to verbalize at all, and so that's the time when you really have to hear with your heart. I mean, you really have to be able to kind of try and see what they're feeling by their facial expressions. Supplying information instead of asking questions. I still do this all the time. What'd you have for breakfast today? Or what are you doing? Or, what'd you do today? And those are just the wrong, they have no clue what they did today. So I'm trying to remember to say, I did this today. Have you ever done that? Or, what do you think of that? Or I'm having a steak. What do you feel like today? Instead of trying to ask her questions that I know just make her go, oh my gosh, I don't know how to answer that one. So sometimes conversation isn't really what you need. Maybe the room's too bright. Maybe you put music on. Maybe you put their feet up. Just whatever will bring them comfort. So sometimes you may just simply share some time with a person with dementia in silence. Relax and try not to be quick to end the time. So allow the person to express their feelings in his or her own way, at his or her own pace. I think that's really what we try and do with Stephen Ministry anyway. So this is a good test of being able to do that. So that listen with the ears of your heart is how we kind of summarize that.